clean my price.
Oh, let's have a look. It's a big teddy.
Yeah. Oh, I should have brought a bigger bag.
Yeah.
Hi, come on in. How are you? How can I help?
For the last 2 weeks, I've kind of not been feeling right. I've been feeling really tired and drained and just bloated all the time and constantly going to the toilet. I had a miscarriage in February, but I don't think it came out. So about 12 weeks ago, I had a D&C and a laparoscopy.
Right.
And they removed something. Still not come on my period. Literally in the last few weeks, I could be sitting there and I'll just fall asleep, and that's not like me. I've got a 4-year-old, but I'm not doing anything over excessive or anything like that. And I don't know, I just don't feel right.
Have you lost any weight or anything?
In the last year, I lost quite a bit of weight, and everyone kept saying, oh, where have your legs gone? Where have your boobs gone? Where, you're just shrinking. But now it just feels like I'll eat something and my belly feels like it's out here.
Do you think your weight loss is related to your mood?
Not really. I'm quite a happy, positive person.
And what about your sleep? Is your sleep okay?
When I sleep okay. Living with my mum, my daughter sleeps in my bed. The flat isn't big enough for her to have her own room.
And what do you do for you? What sort of things? Is there any you time? Do you get any time?
Not really.
No. Is that because there's a girl?
Yeah. Okay. Occasionally, maybe of an evening, my mum will have her and I'll go and stay at my boyfriend's.
Is there any depression in your family at all?
My mum suffered from depression. She was off work for quite a while with depression and anxiety.
Do you feel depressed, do you think, now?
No, I don't feel depressed.
So how tall were you?
About 5'6".
So your BMI is just sort of 17 and a half, so that's underweight. It's quite difficult to get into this underweight category, actually, so that's quite significant. I think, a lot of your symptoms are due to the way you're feeling psychologically, but they do have an effect on the way your body works and the way you feel about your body as well. So if you're feeling stressed and tired or feeling depressed, then it can make your body functions feel different, and you can have abdominal symptoms, you can have all sorts of other things that you might, if you're anxious, you might get fast heart rate, that sort of thing. So the mind has a big effect on how we feel about our body and how we feel it's working. What I want you to do is just do a urine sample. We should just do a couple of blood tests. Probably the most important one to do is the full blood count to make sure you're not anemic or nutritionally lacking in anything, and a thyroid test, because if your thyroid gland overworks, you can lose weight. And then if we bring you back next week with these results, it'd be nice to catch up and we can go through that. Okay.
Thank
All right.
you.
Okay.
Just when I cough, my chest been pretty hurting along with walking as well.
And the chest pain, tell me about the pain. Is it a sharp pain when you're coughing?
Sharp pain is literally centralised smack bang in the centre of my chest. It's just like, feels like a bang across my chest, really tight.
Okay.
Because I've had heart problems before.
What heart trouble again?
It's swollen ventricles.
Any sweating, nausea, vomiting, dizziness associated with the chest pain?
It's when I cough, I get a bit dizzy, and apart from that, it's just constant coughing, just chest pains, and it's restricted breathing, really.
Okay. Jump over here for me. Let's check. Arm like this, please. Okay, now, I'm just going to have a listen to your heart, if that's okay. And take some nice big breaths in and out. And again. And again. Okay, come and grab a seat for me. Now, there's very good things. So the good things are your temperature's perfect, your oxygen levels are perfect, your heart rate is perfect. However, The thing that concerns me is when anyone gets a tight pain on the chest, we need to make sure this is not related to the heart. Does that make sense, okay?
Yeah.
And the best way to do that is by getting a blood test done. That really should be done at the hospital because, of course, if that comes back as abnormal, then they need to action and make sure that there's nothing else worrying going on. Does that make sense? So I think that's what we should do today. I think we should get that done today, okay?
I'll have to swim past work first, though.
You should go there now,
Okay.
all right? You don't need to worry about work because if you do suddenly develop, tight chest pain, you feel like you can't breathe, you're sweating, nausea, vomiting, dizziness, then that could be the heart. You call 999, you get yourself to hospital via an ambulance. Does that make sense? Take that straight up to A&E reception. When you go up to them, just mention that you've been sent by your GP for chest pain.
That's fine.
All right, buddy? No trouble. And make sure you go straight there now.